Hi, I'm Dr. Evelyn with Petsadena Animal Hospital, and today I'm here to discuss with you your puppy and kitten's first vet visit. Typically, your first puppy or kitten visit will include a consultation about vaccinations. Depending on which vaccines your puppy or kitten has already received, we can tailor the vaccine recommendations specifically to your pet. We also cover nutritional consultations. We discuss proper diet recommendations. In addition to that, we cover house training recommendations or any questions you might have about that. And we discuss puppy and kitten socialization and any behavioral problems that you might encounter at home. We also will discuss parasite prevention. Typically, that's going to include testing for parasites and different recommendations for treatments for parasites. Along with our consultation about your puppy and kitten's needs, we also perform a thorough physical exam to ensure that they're nice and healthy. Furthermore, we'll discuss spaying and neutering your pet. And don't worry, spaying and neutering can be a scary topic to consider. However, we will provide you with the information on the benefits of spaying and neutering. Being a new puppy or kitten parent can be nerve-wracking. There's a lot of questions that might come up. That's where your veterinarian is your best source of information and can point you towards the right resources. Hi, I'm Dr. Evelyn with Petsadena Animal Hospital, and today we're going to discuss routine wellness exams for senior pets. Just like people, as pets age, they start to require more specific care and extra attention. As their immune system starts to weaken, possibly, they start to develop different ailments, it's important that we do what we can to detect these problems early on, because unlike people, our pets don't always give us signs that are obvious to tell us that they're ill. We consider a senior pet a pet that's over the age of 7. This will vary, especially for dogs, as smaller breeds will age slower than larger breeds. However, it is still important to have your pet evaluated as a senior pet after the age of 7 to make sure that we're detecting any problems that might start to occur. Here at Petsadena, we like to see our senior pets at least every 6 months or twice a year. During your pet's senior wellness exam, we will perform a thorough physical examination looking for disease processes or problems that we might start to find in pets as they age. Additionally, your vet will cover preventative care items specifically geared towards your pet's needs based on their breed and their age. Some of the preventative care items that we cover would include recommendations for vaccinations based on your pet's lifestyle and risk of exposure, recommendations for parasite prevention depending on your pet's risk of exposure as well, and checking them for parasites and other infectious diseases that they might be susceptible to. Some of the more specific topics that we'll cover for your pet would include discussing their mobility, as many pets as they age will develop arthritis. Additionally, we talk about their mental health and their mentation, making sure that they're alert and bright, discuss the possibility of some senile changes starting to occur and what to watch for. Older pets are also more prone to developing lumps and bumps. So at those visits, we will discuss any potential lumps or masses that you found on your pet since their last visit and discuss the possibility of testing them or monitoring them and what to do next. Senior pets have special needs based on their age and their metabolism, in which case a lot of times we'll discuss senior-specific diets. Not only that, but they can also develop certain ailments which special diets may be recommended. Pets as they age can start to develop hearing and vision issues. Those are things that we can discuss at our visits and pay special attention to those organ systems to ensure that we maintain them as healthy as possible. At your pet's wellness visit, we will also discuss performing early detection lab work, mostly in the form of a blood and a urine test. Early detection lab work is important so that we can not only assess your pet's external health with our physical exam, but we're also assessing your pet's internal health so that we can intervene and work to treat the issue before it becomes more problematic. Keeping up with your pet's routine vet visits will not only save you money in the long run, but it is important in helping you keep your pet as healthy and happy as possible and ensure they have a good quality of life for as long as possible. Hi, I'm Dr. Evelyn with Petsadena Animal Hospital, and today we're going to discuss parasite prevention. Parasite prevention is one of the easiest and most inexpensive ways to keep your pet happy and healthy. Not only that, but it can help keep you and your family healthy as well. At Petsadena, during your routine wellness visits, we will discuss parasite prevention. Parasite prevention includes discussing different parasites that can potentially infect your pet in different circumstances. Parasites are everywhere. They're a problem worldwide in every environment. That being said, we can keep our pets happy and healthy by either screening them for parasites and treating them early, or having them on preventatives that can treat those parasites in a timely manner before they cause disease. The types of parasites that we worry about in our dogs and cats include parasites that can be found in the intestinal tract, on the skin, can potentially infect them by mosquito bites, or they can come into contact with in their environment. Some of the parasites that we discussed during our parasite prevention discussion include heartworm disease, which is a parasite transmitted through mosquitoes that can affect the heart and lungs and be pretty deadly. Additionally, we also discuss intestinal parasites that can be picked up from the stool from being on a walk and walking in the environment. We also discuss fleas and ticks, which are not only a nuisance, but can also transmit disease and are very abundant in this environment. Both fleas and ticks can cause devastating illness to both your pets and yourself. That's why if we can prevent them, that's going to be our best measure for keeping ourselves healthy. Fleas and ticks are not the only types of parasites that can be transmissible to people. There are a lot of types of parasites and types of infections that can be zoonotic or transmissible to people that can cause pretty devastating disease. In order to keep your pets healthy and prevent some of these parasites or treat some of these parasites, there are screening tests to check them for the parasites. Those would include some blood tests, which will look for tick-borne diseases, for heartworm disease, and stool tests that will look for parasites specifically in the stool or even parts of the parasite in the stool. Parasite prevention is not only important for your pet's overall health in general, it's extremely important when you're considering traveling. Parasites are everywhere in the world. However, there are some that choose to live in specific areas, in which case the risk of exposure changes depending on the location that you're taking your pet. It's extremely important that if you're traveling, just like you would contact a travel nurse, that you would contact your veterinarian and have a discussion about the types of parasites we should be protecting your pet against. Parasite prevention is an important part of your pet's preventative care, and here at Petsadena, we're here to help you with any questions or concerns you might have. Hi, I'm Dr. Evelyn with Petsadena Animal Hospital, and today we're going to discuss lab work and why it's important to help diagnose and treat patients. Lab work consists of different tests that we can run to get more information on your pet's overall health status. Examples of lab work would include a blood test, a urine test, a stool test, or even tissue samples being sent for a biopsy. Lab work is important for your pet. For example, blood work can help us look at your pet's internal organ function and internal organ health, something that we can't tell by just doing a physical examination. One of the ways we can use lab work to help us diagnose and treat a patient would be if a patient comes in with certain clinical signs or symptoms, such as drinking a lot of water and urinating a lot. There are a number of different reasons for that. Your veterinarian may recommend a blood and urine test to try to identify the cause of your pet drinking and urinating more. A blood test would help us look at their blood sugar, which could potentially catch diabetes. A urine test would help us look at their kidney function and if there's maybe a urinary tract infection that's affecting your pet. There are a number of blood and urine tests that can be ran to check for different ailments and different diseases. Here at Petsadena, we have the ability to perform blood and urine tests within minutes, which can help us diagnose and provide treatment much more quickly than waiting for lab results to return at a different date. This is a machine that runs the urine test. When we perform a urinalysis, it's typically for us to look for any crystals, bacteria, red blood cells or white blood cells in the urine that might suggest an infection, inflammation, some type of abnormality with the bladder. We can get results from this machine in as little as 10 minutes. And this is our machine that runs our complete blood cell count. That allows us to look at your pet's red blood cells, white blood cells, platelets, look for any abnormalities suggesting anemia, suggesting infection, inflammation, and other ailments. Last but not least, my personal favorite machine, this is our chemistry machine. This looks at checking the pet's internal organs function. It'll check the kidney values, liver values, protein levels, electrolytes, which gives us a lot of information about your pet's organ function and overall health. All three of these machines are vital to give us a more complete picture of your pet's overall health. There are more complex blood and urine tests that we do have to send to an outside laboratory. That typically will take more time to turn around and give us results, but they are more complex tests that can give us much more information on your pet's condition. It's important to note that lab work doesn't always provide a diagnosis. However, it can help us rule out other disease processes, which can still help us direct treatment more specifically. Lab work is not only important to help us diagnose and treat sick patients, it's actually equally as important and potentially even more important to help us detect disease before your pet starts to show signs. In the long run, it can help save you money and obviously save your pet from illness that might not be detectable otherwise. An example of early detection lab work would include performing a blood and urine test to check your pet for kidney disease, liver disease, thyroid disease, diseases that can occur as pets age. Being able to detect it early on can help us intervene and keep your pet healthier longer. At Petsadena, we offer early detection packages that can be customized to your unique pet and include blood, urine tests, stool tests, so that we can ensure your pet is healthy inside and out. If you're interested in our early detection packages, lab work, or any type of preventative care, your vet is your #1 resource, and we're here to answer any questions you might have.
Hi, I'm Dr. Evelyn with Petsadena Animal Hospital. Today we're going to talk about end-of-life care. It is a topic that's a little heavier and maybe a little more difficult for people to discuss. However, it's important that you have this conversation with your veterinarian. It can help ensure that your pet has a smooth transition that's pain-free and as comfortable as possible. Here at Petsadena, we customize our end-of-life care to the individual needs of the pet and the clients. End-of-life care can include discussions about pain management and medications that can make your pet feel comfortable. It can include accommodations you can make at home to help your pet move around, mobilize, and perform normal functions daily. It can also include medical treatments that we can utilize to make your pet more comfortable depending on their medical condition. During your discussion with the veterinarian about end-of-life care, we will also go over with you some resources on how to assess your pet's quality of life and ensuring that you can maintain a good quality of life for the time they have left. Let's talk about euthanasia. Euthanasia is one of the most difficult decisions that a pet parent will have to make. It's also a difficult decision for the veterinarians to have to help the pet parents make as well. These are decisions that we don't take lightly, and we make sure that we're with you every step of the way when you're trying to assess your pet's quality of life. When making a decision of this magnitude, it's important that we take into consideration multiple factors. First, we will look at whether or not your pet may be experiencing any pain or discomfort, and look into what options we have to alleviate some of that pain or discomfort. Then we'll look at their ability to perform normal daily functions. Normal functions would include being able to urinate or defecate, getting up to drink water, to eat. Basically want to make sure that your pet is able to have a good quality of life and that they're not suffering. In situations where we're unable to manage a chronic condition, control pain, or keep a pet comfortable, a lot of times the most humane option is to consider euthanasia. Euthanasia can be performed by a veterinarian, either at a veterinary hospital or in the comfort of your own home. There are many veterinary hospitals that offer special accommodations for the procedure to make sure that it is quiet, comfortable, and private. When performing the procedure, typically a sedative is given to the pet ahead of time so that they're not feeling any pain, discomfort, or stress. Euthanasia is much harder on us as people than it is for the pet. The pet is not aware of what's occurring and they're not feeling any pain, any discomfort, any fear. It is actually the most humane way for them to pass. Losing a pet is extremely difficult. In essence, you're losing a family member. And we understand that here at Petsadena Animal Hospital. That's why we're able to provide you with resources that can help provide some support and some comfort after making such a difficult decision. Resources for pet loss support include information on hotlines to call, on support groups, and different articles about processing and grieving after a pet loss. Thank you so much for trusting Petsadena with helping you make this important and difficult decision. We're always here to support you before, during, and after this process. Feel free to reach out should you have any questions at any time.
Hi, I'm Dr. Evelyn from Petsadena Animal Hospital, and today we're going to talk about behavioral medicine. Behavioral medicine includes discussing a behavioral issue and trying to determine whether or not there's a medical cause for it or it's more considered a behavioral problem. The reason it's important to differentiate between a medical problem and behavioral issue is that there are some medical problems that can cause your pet's behavior to change, and those should be addressed more specifically. If there's a behavioral issue, then we want to look into the root cause of the behavioral issue and address that more specifically. Some examples of medical issues causing behavior changes would include a pet having a urinary tract infection, whether it's a dog or a cat, and them having urinary accidents or urinating outside the litter box for a cat, urinating inside the house for a dog. Another example would be a pet who has an ear infection that's painful suddenly becoming aggressive. Examples of behavioral issues that don't have medical causes include a doggy who has separation anxiety, that gets very anxious and distressed when their owner leaves them alone, and maybe even starts to bite themselves, chew on themselves, cause self-mutilation, or maybe starts to destroy things around the house. These are all things that we can discuss during a behavioral consultation with your veterinarian so that we can get to the bottom of things and try to direct treatment more specifically. If we find that your pet is having a behavioral issue that is not medically induced, then we can start to talk about ways to help you work on that pet's behavior. Most of the time, if it's a mild condition, they won't need medication, and we can discuss having you consult with a behavioral consultant or trainer to see about working on different behavior modification techniques. In more serious cases of behavioral issues, we may need medication to help us with behavior modification technique practices. Typically, your regular veterinarian can give you advice on that and maybe give you some techniques to follow. In the severe cases, we may have to refer you to a veterinary behaviorist. Now, most people have heard of trainers, behavior consultants, but a lot of people haven't heard about veterinary behaviorists and don't know the difference. A veterinary behaviorist is a veterinarian who is gone through their veterinary medical training, but they've also endured an additional 3 years of intensive training on animal behavior. They are more equipped at handling severe cases, especially cases that need medications, maybe multiple medications at times. Veterinary behaviorists are also called to help owners with pets with behavior issues, where they have worked with multiple behavior consultants or trainers and have been unable to get the results that they need to make sure that the pet's behavior is managed. Hi, I'm Dr. Evelyn Sagastumi at Petsadena Animal Hospital. Today we're going to discuss wellness exams. Wellness exams are not just for puppies and kittens or very elderly pets or pets with illnesses. They're actually recommended for all pets, all ages, and we recommend for the younger pets who are under about 7 years of age to come in once a year at least. Older pets, since they have other conditions that can come up, will actually be recommended to come in every 6 months or twice a year. A wellness exam entails a nose to tail exam that will incorporate the doctor looking at your pet's eyes, ears, teeth, going down to feeling their body for any lumps or bumps, check your pet's heart and lungs for any abnormalities. Although your pet may appear healthy, a lot of times during wellness exams, the doctor is able to identify problems that you may not have identified yourself at home. Something as simple as an ear infection, a skin infection, possibly an issue with their teeth, and many more types of diseases that may manifest themselves on an examination. We can also identify any issues with their belly by palpating their belly to feel for any masses, enlarged organs, or anything that seems unusual. We will also check your pet's joints and spine to look for any pain or discomfort they might be feeling. A lot of times people will say, well, my pet's doing well at home. Pets are very good at hiding their ailments. So it's very important to work as a team with your veterinarian to ensure your pet's health for as long as possible. In addition to that, wellness exams can save you money in the long run because we detect problems early on. We can address them before they get a lot worse and potentially can be more serious and more costly to treat. Your veterinarian will also discuss standard recommendations for preventative care measures you can take at home. Typically, that will include discussing home dental care, discussing parasite control, discussing any behavioral issues, training issues you might have, and proper diet recommendations. During your pet's wellness visit, your veterinarian will also discuss with you which vaccinations are recommended to keep them healthy against different viruses and bacteria. We like to tailor our recommendations based on your pet's individual lifestyle, which is why it's important that we see them once a year so we can have those discussions, as things can change, their lifestyles can change, their environment can change during that time frame. At Petsadena, our wellness visits are 30 minutes long to allow us plenty of time to engage in a conversation and discussion with our pet owners so that we can discuss how we can best fit your pet's needs and work as a team together to make sure that we ensure your pet's health for as long as possible. Hi, this is Dr. Evelyn Sagastume again from Petsadena Animal Hospital. Today I'm here to talk to you about microchipping. Microchips are actually a small little device that gets inserted under the skin in between your pet's shoulder blades. It's about the size of a rice grain. It's inserted with a needle that can look intimidating, but it's just a small little poke, tiny little prick that they feel, and actually can be done with them awake. It's extremely important to microchip your dog and cat, even if you have a collar on them, because a collar can get lost, especially in circumstances that are frightening for them, some type of natural disaster, maybe they ran out and got frightened. If you have a microchip, the microchip stays with them forever. The microchip is not a tracking device, so we won't be able to GPS find your pet. However, it does provide contact information to reach you should your pet be found and have their microchip scanned. The microchip is the one thing that can improve the chances, and honestly it does improve the chances of our pet being reunited with us. The way it works is actually there is a wand scanner that we will use to scan the microchip, and it will give us a number. The number that pops up is actually registered with the database. There's multiple companies that will register the microchip for you and store your information. If a pet were to get lost, they would be brought into a facility like a veterinary hospital or a shelter. We would scan the pet and get a microchip number. That number is registered to a particular company. There's actually a website that we can look up to see where the microchip's registered, and we can contact them and let them know we have the pet. That information would get passed on to the company who has your contact information in their database. Then they would be able to contact you directly and let you know your pet is in a particular location. Not all microchips are created equal, so there are some that have an 8 to 10 digit code and some that have a 16 digit code. The 16 digit code microchips are the ones that are considered to be ISO compliant, which means that when you travel abroad, those will be accepted by the different countries who will require that they have a microchip and scan them upon arrival. So you do want to make sure that if you're traveling abroad, you speak with your veterinarian about the type of microchip your pet has, and we can easily determine that by scanning. Getting a microchip into your pet is an easy process. It takes less than 5 minutes, it's virtually pain-free, and any pet of any age can get microchipped. So please consider getting your pet microchipped. If you're not sure if they're microchipped, you can take them into your veterinarian and ask them to scan your pet with the scanner, and we can determine if they do or don't have one. If they do have one, we can also give you the information for where the microchip is registered. Scanning your pet's microchip is easy and painless. We just move the wand over the area of the shoulder and we can obtain the number of the microchip, and a lot of times it'll also give us the information of the company who makes the microchip. Here at Petsadena, our microchips are ISO compatible, they're affordable, and we're happy to answer any questions you might have about microchipping your pet. Thank you. Why do we use laser therapy in animals? Laser therapy is a cold laser that's actually going to increase circulation and blood flow to the cells that will help reduce inflammation and provide nutrients for the cells to improve and speed up their healing process. Laser treatment is used in animals for various conditions, whether it's something that is acute, so something that happens all of a sudden, like an injury to a ligament, to a muscle, or to possibly a ear infection that might be causing significant pain and inflammation. Something more chronic would be something like arthritis. We also use it after procedures where we expect there will be inflammation and pain, so that it can help speed up the healing process, reduce pain and inflammation, and make the pet more comfortable. Laser therapy is typically performed without sedation, definitely without anesthesia. It is known to be very much pain-free. Each laser treatment takes about 2 to 8 minutes to perform, depending on location. There's not really any side effects that are known to occur with laser treatment. If there is maybe a little sensation, it's happening during the treatment, not typically after the treatment has been performed. Treatments can vary from performing 1 or 2 treatments to doing chronic therapy treatments that would be done on a bi-weekly or weekly basis. Depending on the condition, the doctor would tailor the recommendations for laser treatment for your individual pet. Typically, if it's something acute, you may see results fairly quickly within 1 or 2 treatments. For more chronic conditions, it may take up to 2 to 3 treatments to see improvement. So it can take a few days to weeks to see the results. Laser therapy can be used in conjunction with other treatments and/or medications. An example is chronic arthritis. We use laser therapy fairly frequently for our arthritis patients in conjunction with their pain medications and non-steroidal anti-inflammatories. This is what a laser therapy entails. Typically, the people performing the laser treatment will be wearing goggles to protect their eyes, also will protect the patient's eyes. This is the one that we use that will emit the cold laser to the location that we select for treatment. We use laser therapy for a lot of times for pain and inflammation. So whether it's an issue with the back, where we would laser the back area, an issue with the ear inflammation, infection, we would laser the ear. We actually also use it for inflammation of the mouth as well. After our dental procedures, we will perform a laser session on any patients that have teeth that are extracted or pulled, and that helps with inflammation and healing process. When your pet comes to Petsadena for an ultrasound, this is what to expect. Ultrasound is a modality that we use to assess the internal organs of a pet, whether it's in the abdomen, looking at organ systems like the stomach, the liver, the spleen, or in the chest, looking at the heart, the vessels, and potentially even the lungs. We typically recommend ultrasounds when there's an abnormality, either on a blood test or an x-ray, that we need to further assess the organ and look at its architecture. Ultrasound is a useful modality for those kind of situations because it's pain-free, typically can be done without sedation or anesthesia, and is a fairly quick procedure to perform that gives us a lot of information. We can look at multiple organs at once. We also will check the chest or the belly for fluids, abnormal masses or growths, things like that, that you wouldn't otherwise be able to see with, say, an x-ray. Here we have our ultrasound machine. This machine comes with different probes. This is the ultrasound probe. This is what actually will send the ultrasound rays into the organ system that you're looking at. That allows us to look at fine details and architecture of each individual organ. So this is how we perform the ultrasound. As you can see, our patient is actually put on their back. This patient is actually not sedated most of the time. Once we can get them into a comfortable spot, they will lay there and allow us to do what we need to do because it's not a painful process. We typically will shave the belly if we're doing abdominal ultrasound, or if we're doing an ultrasound on the chest, we'll shave the chest if needed to get better visualization. Usually we will put alcohol onto the body, and we will put a gel that helps transduce the ultrasound through the body into the organ. We're not shaving this doggy for the video purposes, but you can still get a reasonable image. Just know that if your pet does get an ultrasound, they will have their belly shaved. So we'll put a little bit of alcohol onto the belly. We'll use the ultrasound gel to allow us to get better contact. And then as we're looking through the different organ systems through the belly, we can actually see an image on the ultrasound. So this is what we're looking at, details of how the organ systems look to determine if there's any abnormalities. If we find an abnormal growth or abnormal structure, we can actually get samples of the structures by using ultrasound guidance and a needle if needed. That procedure typically requires some sedation. But just for scanning, for the most part, most pets don't feel any pain or discomfort and don't have to be sedated. And that's as easy as it is to have an ultrasound performed at Petsadena Animal Hospital.
When your dog and cat comes in for a professional dental cleaning with us at Petsadena, these are the types of machines and equipment that we use to make sure that your pet is safe under anesthesia and perform the procedure itself. This is the pre-anesthetic exam. We evaluate every patient prior to anesthesia to make sure they're healthy to go under anesthesia. This is the pre-medication. This is a opioid pain injection along with a sedative to calm them down and prepare them for anesthesia.
Now I am shaving her arm to make it a cleaner area to place the IV catheter. These are the items we're going to use to place our little dog under anesthesia.
We use an injectable anesthetic called propofol. We give that injection in the vein that will allow us to get them to a level of anesthesia where they're unconscious and we can go ahead and intubate them. So this is our anesthesia monitoring device. This allows us to look at multiple parameters while they're under anesthesia. So we have our EKG here that tells us their heart rate and rhythm. We still utilize stethoscopes to listen to them. You always want to make sure that your patient is what you're monitoring, not the numbers on a machine. We also look at the SpO2, which gives us the oxygen saturation. Our end tidal CO2 is the carbon dioxide level. That tells us that the body is oxygenating appropriately. We also can see the respiration there. That level, we want to make sure that the animal is breathing on their own. If for whatever reason they're having difficulty breathing on their own because they might be under anesthesia a little too deep, we can go ahead and manually breathe for them. We also check their temperature. That's allowing us to make sure that the temperature doesn't drop too much. This is the blood pressure parameters. We want to make sure that they maintain their blood pressure. This blood pressure monitor is taking parameters every minute, and we're recording all these parameters every 5 minutes on our anesthesia monitoring sheet as well. But as the procedure's going, we're making sure we're assessing our patient on a regular basis.
We're taking x-rays and we want to make sure that we get the whole root in the picture, just so we can see if the root is infected or the tooth is in any risk of an infection.
So after the technicians have taken all the x-rays needed, the doctor will go ahead and review the x-rays and look for any abnormalities.
The next step in the dental is to record the findings and probe each tooth with this instrument here. We're going to check for periodontal pocketing. If this slips more than about 3 or 4 millimeters, it indicates that there is disease there. During a dental procedure, we use this scaler to remove tartar from the teeth.
So when you scale and you get a lot of bleeding, that's from the tartar buildup up there, and the gingivitis is basically starting to perform in there.
The next step after scaling is polishing to remove the microabrasions that we've created during the scaling process.
Hey guys, how's it going with the dental?
Great, thank you, Doc.
Alright, so it looks like we're finishing up polishing here. So polishing is very important after we go ahead and scale and clean the teeth to make sure that any sort of nooks and crannies that are left irregular on the enamel is going to go ahead and be smoothed out, because you can definitely get more bacteria and more plaque that gets built up because of irregularities there. So we definitely need to make sure that we go ahead and polish them and make sure that they're going to stay as healthy and happy as possible. Fun fact, guys. So Definitely, a lot of owners like to buy tools at home to scale their own dog's teeth, and they remove the plaque off the teeth. We highly, highly recommend to not do that because they aren't able to polish afterwards. So this is the reason why we do polishing, again, to get all that irregularity on the enamel after we remove it, to prevent any further bacteria and any further gingivitis and all those things from happening. And so when you actually scale the teeth at home, you're causing more irregularity on the enamel. So we always recommend to not do that so we can properly clean the teeth, make sure we put the polish, and make sure we prevent, again, more bacteria from happening and more plaque from happening.
If there's no extractions, this procedure usually takes an hour and a half.
Now that the cleaning and polishing has been completed, the doctor comes in and does a thorough oral examination. So we'll probe all the teeth. We will look at the gums and look for any abnormalities like growths on the gums, any ulcers, sores, anything like that. That might be of concern. This is the only way to evaluate their mouth thoroughly, which is why we recommend professional cleanings under anesthesia.
The last step of our dental cleaning is to apply Oravet sealant to all the teeth. This dog didn't need extractions, so we're gonna just do this right away. This gel protects the gum line from bacteria entering the bloodstream. And also, for the next 2 weeks, the owners are not able to brush, so this also prevents any tartar buildup for the next 2 weeks. Now that the dental is over, we're going to wake her up gently and watch her for the next 2 hours to make sure that she does well after anesthesia.
Did so good.
Good girl. We're going to put her in recovery and we're going to watch her for the next 2 hours.
Our patient recovered well. The procedure went very routine. This is what we like to see for our routine professional dental cleanings. And she will get to go home in a few hours after we ensure that she has recovered fully from anesthesia without any complications. Thanks for watching.
Hi, I'm Martin Haynes, and I'm the acupuncturist here at Petsadena in Pasadena. I have been doing acupuncture with animals about 20 years. Meet Roscoe. Roscoe is a 14-and-a-half-year-old corgi. I mean, at 4 years he had a problem with intervertebral disc disease and had surgery done. And does he like this? He hasn't bitten me yet, so I'm guessing he's okay with it. So these are the teeny weeny needles. Needles we use, they're the same needles that I use on people as well. But people make a far bigger deal of it than dogs. I think one of the more common questions people ask me is, how do we keep the dog still while we're applying the needles? And this is just what it looks like. I mean, virtually every treatment, it looks very similar to this. What happens is that the needles encourage the body to release endorphins, which helps obviously with the pain, and the dogs like it because it's just like drugs. Typical treatment will take about 20 minutes. Then we just sit and wait. Typically, we'll get referrals on animals that have chronic pain or unmanageable pain with drugs. With needles, the side effects are the worst thing that will happen is nothing. So we don't have that kind of risk to worry about that we do with drugs and side effects. We can treat virtually anything. Not that we can treat everything as well as Western medicine, but together we do pretty well.